My name is Dr. Mia Steyn, and I'm a consultant dermatologist. And today I want to talk to you about rosacea. I see this all the time in my clinic. So, what is rosacea? It is not just redness. It is actually a fairly complex chronic immune-mediated skin disorder, and it can present in a variety of ways. When patients come to the clinic, we often focus on symptoms, as that will help us narrow down whether this is rosacea or whether it might be something else. The most common symptoms patients will report can range from fairly mild redness or flushing, blushing, often triggered by very specific environmental stimuli, all the way through to quite troublesome burning, stinging, and hyperreactivity of the skin. You can also develop fixed facial redness and very noticeable thread veins or little spider veins on the cheeks. In different forms of this rosacea, you can find that you get breakouts. These may often be misdiagnosed as acne. And in more severe forms, you can get what's called Rhinophyma, where you get very persistent swelling and thickening of the skin, most prominently over nose. It's important to remember that rosacea can also affect eyes. Ocular rosacea is underdiagnosed, but very troublesome and can cause itchy, burny, scratchy eyes with frequent styes or cordeola. Now, once we have discussed your specific symptoms and the way that rosacea is presenting in you, and we've done a deep dive into your triggers and the environmental factors that might be contributing to your skin disease, that is usually enough for me to make the diagnosis. Rosacea is a clinical diagnosis. In rare occasions, you might need an additional blood test to help me exclude other things that can mimic rosacea. Then we move on to treatment. So treatment you really have to think about as your treatment for a flare and then your maintenance treatment. Rosacea is a chronic condition, and whilst we can't cure it, we can manage it really effectively. The foundation of everything we do in managing rosacea is getting your skincare right. If your skincare is too harsh or too aggressive, your rosacea will never get better. And one of the reasons for this is that a key pathophysiological element of rosacea is barrier dysfunction. So we focus a lot on getting your skincare right, making sure you know your triggers and how to either modify or avoid them. And then we add on. Our management can take the form of prescription topical medications. So these would be creams or gels that you would apply. And this could either be for long-term management or to help manage a flare. We can then also add in systemic medication, which would be tablet-based medication. And these could be focused on helping control specific elements of your rosacea, so a situation of flushing or blushing, or a long-term anti-inflammatory medication. Finally, we can also discuss whether you need procedures to help treat your rosacea. This would be something like a laser treatment or an IPL. The most important thing to remember is that your rosacea management will probably consist of phases. I will give you a short-term SOS plan to manage flares, and then a long-term maintenance plan so you can take back control of your skin.